I also think that the care providers who are investing in technology will start to be differentiated from the ones who aren't. People will start to see that technology is making a difference. Technology is undoubtedly going to transform our sector. And I would say to my colleagues, it's going to happen. So jump into the driving seat rather than be run over by it. And I think we've got to be proactive in terms of technology.
So in your presentation, you spoke about workforce as being part of the agenda. Does well-being fit in there?
Definitely. I think we have to understand that you cannot deliver high quality care that enhances the people you work with's well-being without your own well-being being supported and taken care of. And I think that's another area that we've been very lacking in understanding of. And I think people in care services have often been thought of as the people who can cope with anything. And that has been the way in which people have sort of ignored their well-being. Well, actually, and we've seen it and we will see more of it post-COVID, people have been through tremendously difficult times. We've got to nurture our colleagues because you can only give the best to others when you have a good well-being yourself.
Yesterday we did touch on the importance of well-being in a care home, and Colin has joined us now, which is the founder of Microstrategies.
Like how we got involved into this industry is, some family bereavement of my father. My business partner's father passed away last year, and we've seen, they suffer from dementia. And when we went into the care homes, because we were doing some work, we then developed technology to enhance the well-being of the residents in the care home. And one of them is this panel here, which is, allows them to see their family on a large screen. It uses a 4K camera, and it just enhances the actual experience of when they're talking to their family. And then this panel then turns into a training platform for their staff at the end of the day. And it's pretty simple for us as a technology company. It's really easy to manufacture this and create it. It's just putting it together and ease of use. So as soon as you turn it on, then it works. So it was really refreshing. We do lots of things which has really helped the care home industry. So it's really refreshing to hear that. And like you say, one of the biggest barriers from this is cost, and and the money and the grants that are available, and things that we've done as a business is making that easier. So one of them is that we provide all of our things as a service, as opposed to just buying the product outright, and then it's just only used and utilized when it's needed. So it was really refreshing to hear some views on that.
Yeah, Colin, thank you very much. And I think also it's really interesting that you developed this because of your own personal experience. And sometimes I think the best things come out of understanding, what works and what doesn't work when you're in the situation. I also think that your system will have been so well used during COVID. And what I think is really important is to recognise that often people who live in care homes might have family members who are scattered all over the globe, and the things that you provide can connect people right across the globe, and it can really enhance people's well-being, because if you feel connected with your families, if you can't see them physically, if you're connecting with them, that's really great, and particularly for people living with dementia. So I think, and also the fact that the system can be used in training is also a great element of it. So well done for producing something that I think makes a difference.